The MITSS Hope Award was established in 2008 by the MITSS Community Outreach Committee to recognize people who exemplify the mission of MITSS, supporting healing and restoring hope to patients, families, and clinicians who have been affected by adverse medical events. This recognition can be for patients, families, healthcare providers, hospitals, teams or departments, academic institutions, community health centers, grassroots organizations, and EAP programs. We accept nominations from the US and Canada, and every year, the quality of submissions is incredibly impressive. It's been wonderful to see the amazing work that people are doing that exemplifies the mission of MITSS. Please welcome Sanjay Malavia from RL Solutions, who sponsored the Hope Award, to present tonight's Hope Award.
All right, another great night. Thank you to all of you. Thank you, Linda, the MITSS Board of Directors, the dinner co-chairs, my own leadership committee colleagues. Took forever to take pictures up here earlier. Our distinguished guests and everyone else, ladies and gentlemen. On behalf of everybody at RL Solutions, I'd like to thank you once again for giving us this prestigious honor to sponsor the MITSS Hope Award. Yeah, it's our 7th year, and we would graciously accept 20 more if we could. And I say it every year, and I'm not going to stop today. We will be supporting MITSS, Linda, and the Hope Award for as long as Linda and the MITSS Board allow us to do it. The Hope Award has become such a prestigious and revered award nationally for the patient safety and patient advocacy communities. And this is due first and foremost to that lady in red walking around today, her passion, her tenacity. She's channeled her personal story into a national movement for protecting others from harm and for supporting all parties who are affected by preventable harm when it occurs. And it's also due to her vision and the vision of the MITSS Board, who thought when they created this award that they would like to bring national recognition to other folks like Linda that give so much of themselves to live and further the core MITSS values. And lastly, it is of course due to the heroic alumni of this award. They are the true leaders, the true activists, the giants in the field of patient safety and patient advocacy. They are advocates, they're researchers, they're administrators, all with the passion to prevent harm from reaching others. And through their tireless efforts, they save lives, and they bring honor and credibility to everything that they do. Tonight's recipient is going to fit perfectly in this illustrious group of people. Last month, October, for those of you who don't understand months, marked the 7th World MRSA Day and World MRSA Month. So MRSA is methicillin-resistant Staphylococcus aureus. I practiced that for 10 days before coming here. I know this is a healthcare group, but there's got to be other simpletons like me out there, maybe a girlfriend, boyfriend that's here, and I feel like I need to explain what MRSA is. It's a bacterium, and it causes an antibiotic resistant and potentially fatal infections. And too often these infections are acquired in a hospital setting when routine medical procedures are taking place. So World MRSA Day and Month raise awareness of MRSA around the globe. They activate survivors of MRSA, the communities, the governments, the healthcare providers, and officials to join in together to stop the spread of this preventable disease. And all of these global awareness campaigns exist because of this year's Hope Award winner. So Janine Thomas is first and foremost a survivor. Her story started with ankle surgery, which then took a 5-month turn as she was bedridden and fighting for her life against hospital-acquired MRSA. And it ended, well, it didn't end. It could have ended with Janine going back to her antiques, to her tennis, resuming life with her beautiful family, and putting it all behind her. But instead, like many Hope Award winners, she channeled her personal story into a national movement to keep others safe from harm. And doesn't that sound very familiar? She started the awareness campaigns I mentioned. She set up a MRSA Survivors Network. She worked with hospitals in her community and with legislators and senators, including a young chap named Barack Obama, in her home state of Illinois, to pass bills related to disclosing infection rates in order to highlight the prevalence of MRSA. She's worked to develop a culture around prevention and screening. She's created programs to educate patients, families, and healthcare providers about MRSA. And today she's campaigning for federal laws to mandate MRSA screening in every single state. And she also works with the World Health Organization and other advocates to continue to raise global awareness. Because of her patient advocacy work, more than 50% of all the hospitals in the United States are now screening patients for MRSA. MRSA infection rates have dropped by 13%, and the invasive MRSA infection rates have dropped by 50%, according to the Center for Disease Control data. 30 states now have mandatory infection reporting legislation in place. Janine is seen as one of our nation's most influential patient advocates. She is a tornado of positive energy. We're so lucky to have her working relentlessly to protect us and our families. And it's my honor, my pleasure, on behalf of RL Solutions, MITSS, the entire Hope Award Committee, to present Janine Thomas with this year's Hope Award.
I'm very honored and humbled by being chosen as a recipient tonight for your prestigious award, and a heartfelt thank you to RL Solutions and MITSS, and especially Linda Kenny for all the work she's done. Let's give Linda a hand. I met Linda in 2008 in Chicago when we were at a World Health Organization patient safety workshop. You both have been pioneers and leaders in patient advocacy work and innovation. My journey in patient advocacy was very unexpected, as most are. In December of 2000, I slipped on black ice, of course, Chicago, that's where it's at, and broke my ankle, and I needed surgery to repair it. I had to have hardware put in. I was infected with MRSA during surgery. We believe it's contaminated surgical instruments. And the bacteria went into my bone marrow, giving me osteomyelitis. I went home and ended up back in the hospital with a MRSA infection. Tested positive, but was not put on vancomycin. 3 days later, my temperature went to 105, and I went into septic shock and multiple organ failure. I was saved by the night nurses, and boy, they are angels. And I was in and out of consciousness for days, and multiple surgeries in an attempt to save my leg. After a month in the hospital, my leg was stabilized, and I went home on antibiotics. And 2 weeks later, I woke up with a fever, high fever, and diarrhea, and I went to the ER, and I was diagnosed with C. difficile. I needed a bone, skin, and muscle graft and was not able to have it, and I had an open wound for 6 months. After a total of 8 very painful surgeries, MRSA moved into my sinuses, and I was ill off and on for 4 years, and no one knew what to do for me. I spent a total of 17 months in bed, and finally, MRSA settled down in my body, but I was left with a permanently compromised immune system. While still fighting MRSA, I started my organization in 2003 because while I was going through my medical ordeal, there was not a support group for MRSA. There was a support group for every other disease, and going through this was very isolating. MRSA Survivors Network focuses on destigmatizing MRSA, giving support, raising awareness, educating the public and healthcare industry. We help patients understand all the psychological aspects of this disease. Feelings of isolation, depression, PTSD, anger, anxiety, and all of those are normal. MRSA Survivors Network operates the only crisis hotline in the U.S. In July of 2000, the Chicago Tribune released their groundbreaking investigative series on healthcare-acquired infections. And finally, somebody was talking about this. I contacted one of the reporters, Mike Behrens, and asked if there was any patient advocates that he knew who were working on this issue. And he said, no, but it starts with you. And then I knew I had to try and do something on my own. In 2003, Illinois State Senator Barack Obama introduced the Hospital Report Card Act, which mandated that hospital infection rates be publicly reported in RN to patient ratios. I worked on getting that legislation passed and was placed on the State Advisory Board. It was never my intention to initiate legislation, but I saw it as the fastest way to save lives and to prevent infections. I initiated my own groundbreaking legislation in 2006, the MRSA Screening and Reporting Act, which passed in 2007. It was the first in the country, and now 5 states have similar legislation, and nearly 50%, as Sanjay said, 50% of hospitals are have a screening program, and 30 states are publicly reporting. And as we know, the VA health system are screening every patient in their facilities. On October 2nd, 1960, Dr. Patricia Jevons of the UK was the first person to identify MRSA under her microscope. And in 2009, I declared October 2nd World MRSA Day and October World MRSA Awareness Month, and initiated a US Senate resolution officially declaring these awareness dates, and it passed in 2009 with Senator Durbin. We hold, as Sanjay said, we hold an annual kickoff event, a World MRSA Day kickoff event, and Global C. diff Summit in Chicago. I'm still trying to pass the World MRSA Day in the House, and we currently have House Resolution 439. I think it's my 4th or 5th try. Can't get it through the House. I work on a global level, and in 2008, the World Health designated me a patient safety champion. And I helped to create their hand hygiene and antimicrobial resistance campaigns. They honored me last year by appointing me as an advisor to their ethics committee panel for the Ebola virus. And wow, as you know, that was a media firestorm. In many ways, my work for the past 14 years still seems in its infancy. And I know that there is so much more that needs to be done and accomplished. My goal is to have every healthcare facility screen high-risk patients upon admission and publicly report infection rates and put MRSA on death certificates if it is a contributing factor or cause of death. We need true transparency. I am very blessed and grateful to be here, and I have dedicated my life to this work, helping others who suffer from these infections, raising awareness and educating. Something good came from what happened to me, and I take solace in the fact that I am helping to prevent needless pain and suffering and deaths. I would like to honor and give credit to my 2 mentors, Dr. Barry Farr, Emeritus of UVA, whose hospital was the first to start screening for MRSA in 1978 and eradicated it, and to Dr. William Jarvis, another ID specialist and researcher, formerly with the CDC. Without their support, education, and inspiration, I could not have accomplished anything. Thank you kindly once again for this wonderful recognition. For MITSS and MITSS Survivors Network, I am truly grateful.
You knew I couldn't take an opportunity not to speak at the dinner at all. So it's an honor and a pleasure. Come on, Sanjay, you're supposed to be here with me. This year we thought we'd do something different, and actually Sanjay and RL Solutions and his team was right along with me. There's a man that we want to honor that is retiring, and I don't know if he's retiring from everything, but I really like it better when I can see people. But we wanted to honor him this year, and we wanted to present this gentleman with an honorary Hope Award. And I'll let, do you want to say something before I announce him? Okay. And that's Mr. Dr. Lucian Leap. But before he comes up, I want to tell you a quick story. I meet him the first time, and I mean quick. I meet him the first time, and he says, Linda, you know, we've seen each other, but we haven't worked together. Do you have a few minutes? Now, I'm asking him, I'm sweating. If you looked under my jacket, it would just been a drainage. I was like, oh my, I'm in Lucian Leap's office. He agreed to meet with me. I'm asking him to be the keynote. And then he said, hey, I'd like to know a little bit more about you. Do you have time? Can you take a few minutes and you know, so I can learn a little bit about you? I was floored. I'm like, this man wants to know who I am? I was, and then the second time I think I met him, we were going to speak at something together. And in the middle of dinner, he says, why are your fingernails square? I'm like, what? He said, why are they square? And I said, because I like them that way. And he goes, well, I don't. And I thought, to hell with you. Come on up, Lucian.
Well, I'll be damned. Thank you. Thank you so much. This is wonderful. I knew from the moment I met her that Linda was a winner and that she had something that really had to be done. So it's been a pleasure to play a small part in supporting your tremendous effort. And thank you so much for this.
Everything you've done for patients.
While they're taking photos, let's have another round of applause for tonight's Hope Award winners, Janine Thomas, and for Lucian Leap for his amazing career and contributions.